Golda here. Thanks for joining us. A few updates on healthcare reform bill I want to go over. Have to do with congressional updates as well as a health insurance waiver. First off, a few weeks ago the Senate repealed the 1099 provision, and just recently the House Ways and Means Committee approved to repeal it as well. If you recall, the 1099 provision required companies that do business or transactions with other companies totaling $600 or more in a year have to file a 1099 form with the IRS. It was a brutal provision. Nobody liked it, including the IRS, because they thought there's no way that they can track it, enforce it, and make sure everyone's in compliance. Hopefully this thing gets squared away and it's gone. Another update. Senator Kay Bailey Hutchinson, Representative Eric Paulson, together they introduced a bill that would repeal provisions regarding flexible spending accounts and health reimbursement accounts. One of them, the FSAs, there's now a cap, a $2,500 maximum limit that you can contribute a year to your flexible spending account. This bill would repeal that measure, allow you to put more money, more of your own money in there to buy healthcare goods tax-free. The other provision in there from the healthcare reform is you can't go to the pharmacy and buy over-the-counter drugs anymore without a prescription and have it be tax-free through your HRA or FSA. This bill would eliminate that, saying you need to go and get OTCs, as we call it, over-the-counter drugs. You don't have a prescription, that's fine. Use your flexible spending account. Hopefully this bill gets passed. Interestingly, Senators Ben Nelson and Claire McCaskill, if you remember, when healthcare reform was trying to get passed, these two senators were very instrumental and very big proponents of the bill, especially the individual mandate. Well, now that they're up for re-election next year, they're not that big of fans of it anymore. Reason being, given the climate across America, many Americans aren't too fond of the individual mandate as well. As such, they recently proposed to Congress that Congress consider alternatives around the individual mandate. Very interesting. We'll see what transpires on that. Lastly, health waivers, health insurance waivers. If you remember last year, McDonald's and some other big companies received a lot of waivers. These mini-med or limited medical plans received waivers because under the health reform bill, you have to provide coverage that's at least $750,000. That's a threshold that should provide care for essential benefits per the bill. A lot of these limited plans don't have that. 4 states just received waivers from Health and Human Services, HHS. New Jersey, Florida, Ohio, and Tennessee all received waivers recently. In order to receive a waiver, and this is significant, the bill, you have to be able to show that this requirement would actually cause an increase in premiums or a decrease in access to benefits or access to care. These 4 states show that if they follow the rules of the health reform bill, that this would happen, that premiums would go up, access to care would go down. To show the relevance of this, to date, Health and Human Services has granted 900 waivers covering 2.4 million people. That's 2% of the employer-sponsored workforce. Saying that if this wasn't allowed, if they had to follow the health reform bill to a T, 2.4 million people would not have coverage. Clearly some things need to be changed. Hopefully Congress is working it out, and I'll go back to you with more updates. Thank you. Take care.